Welcome back. For healthcare workers here in Connecticut, things have shifted to a new normal with a lull in our COVID cases. Joining us to talk about that is Jeffrey Flaks, Hartford Healthcare President and CEO. Welcome back.
Thank you, Lisa.
We're seeing the number of COVID cases skyrocket in other states, particularly Florida. So to combat the surge, Governor Lamont is now requiring quarantine for travelers from several states. What has been critical in containing our numbers here in Connecticut, in your opinion?
Look, I'm very proud of what's occurred in Connecticut. When up to this point, when you look at the measures we've taken, the sacrifices people have made, the sense of support we have for one another within all of our communities, it's made an enormous difference. Right? This is about wearing a mask, practicing proper hand hygiene, social distancing, and paying close attention to travel and exposure. So, Lisa, I think we've taken very good measures in Connecticut. We were early. People have been vigilant, and we need to continue to be vigilant to maintain these really very low numbers and incidence level we have within our state.
Yes, we can't let our guard down. So with this virus, anything can happen and numbers can change rapidly. How are you preparing with Hartford Healthcare for a potential surge, especially with back to school and the flu season around the corner?
It's essential for us to prepare for a possible surge or a spike. We've often looked at it from the standpoint in our organization, we have to prepare for the worst, but expect and work towards the best. And in our organization, we're building very significant stockpiles of personal protective equipment. We have acquired a significant number of new ventilators and are ensuring that all of our ventilators are in proper working order and ready to be deployed. We've built personnel pools, and we've done even more with greater specificity, understanding under which scenarios how we could deploy people differently and move people to where the issues matter most. So we've learned a great deal. We've hot washed. We've studied very attentively what worked, what could we do differently, what we could do better, and how to ensure that to the extent this could occur, we would be even better prepared in whatever point in time this might happen.
It's amazing what you've been through. Hartford Healthcare has performed nearly 130,000 COVID-19 tests since March. How important is testing?
Lisa, testing's critical. It's absolutely critical. We do about 1,800 tests a day at this point in time. And our testing sites, we have 8 permanent fixed sites that go across the entire state of Connecticut. And then we deploy up to 5 mobile testing units that go to churches, community centers, schools, nursing homes. It's been critical so that we can reach people. Testing is one of the absolute key strategies in how we contain this. We identify people who are positive. We then put quarantine measures in place. And it allows us to look and identify hotspots. So that daily use of this data, what it tells us, allows us to focus our efforts and contain COVID-19 when it occurs and when we can identify it. So testing will continue to be essential as we go forward, and I'm very pleased at the tremendous commitment we've made. We now have 150 people working full-time in Hartford Healthcare who are exclusively deployed to our testing operation.
All right, and one last quick question. Your experience leading a healthcare system through a pandemic, you were fairly new. What have been some of the lessons learned?
I've said, Lisa, from the beginning, this is an enormous crisis, unprecedented, disproportionate, and what it's done to people and communities, it's been devastating. But as we have worked through this, I've said, healthcare, we don't want to go back to normal. We want to be better than normal. We will be better than normal. So our innovation, our access, focus on health equity, focus on affordability of care, our capacity to connect to our community, our capacity to engage families in the care for our patients. There are so many emerging new approaches that are going to make a great difference. So we are absolutely focused on being better than normal. And for me, in this capacity, serving in this moment, we consider it an enormous responsibility because we are about our community. It's why we exist. And during times like this, we need to stand up, stand together, and do whatever's possible.
All right. Hartford Healthcare President and CEO Jeffrey Flaks, thank you once again for joining us. We appreciate your time.